This lesson I will talk about the muscles of the upper limbs, and more precisely I will talk about the group of the vertebral column. First muscle we should start with is the trapezius muscle. This is the right trapezius muscle. I will first explain the origin of this muscle, then I will explain the insertion, and then we're going to talk about the function of this muscle. The trapezius muscle originates from the skull and some vertebrae. This part of the skull here, then it also originates from the vertebrae from C7 till T12. So from here, this is the 7th cervical vertebra. So it originates from all these vertebrae, and more precisely from the spinosus process of these vertebrae. Now, as I said, it also originates here from the skull, and now I prepared an image to show you more precisely where does it originate. Here you see the skull from below. It originates here from the external occipital protuberance, then from the nuchal ligament and the medial part of the superior nuchal line. So this line here, medial part of it, and the external occipital protuberance. Now if you look at this body from the front point of view, you will see this bone here, and this bone is called the clavicle. If you watch the lessons in my software about bones, I explained the thirds of this clavicle, and I said that these thirds are important because of the insertions of the muscles. And right here on the lateral third of the clavicle, we have the trapezius muscle insertion here. Then it also inserts in the acromion. This here is the acromion of the scapula, and it also inserts here in the spine of scapula. Now the major nerve supplying the trapezius muscle is the cranial nerve number 11. The cervical nerves C3 and C4 receive information about the pain in this muscle. We have the superior trapezius, we have the inferior part of the trapezius, and the middle part of the trapezius. Now, depending upon how they contract and which one does not contract, dependable on that, we have different functions. Now, this is very logical. The superior part here elevates the scapula. When this contracts, the scapula is elevated. Also, we have the inferior part here, or the ascending part of the trapezius, and this part, when that contracts, it depresses the scapula. And then we have all parts together, or just the middle part. When the middle part contracts, they retract the scapula. If the descending and the ascending parts act together, they rotate the glenoid cavity. Now don't think that if this part of the muscle contracts, it should pull the scapula down only, and if this part of the muscle contracts, the superior part, it should pull the scapula up only. No, it's very important where they insert. If they don't do that on their own, yes, they'll just pull it down and rotate it a little bit. For example, if you take a look at the lower part, the inferior part of this muscle, it inserts here more medially, right? And this part here inserts, can you see it? Can you see where it inserts? Inserts on clavicle and here a little bit on the acromion. So what happens basically when this contracts and when this contracts, they make this glenoid cavity here rotate. So they have slightly different insertions, and that's why they can act together, do the action. So they don't just simply go against each other. The next muscle I would like to talk about is the Latissimus dorsi muscle right here. Now first I will talk about the origin of this muscle, of course. So the origin starts from the 6th thoracic vertebra, and it goes all the way down to the 12th thoracic vertebra. It has the origin of the inferior 3 or 4 ribs here, and it also originates from the iliac crest here. It also originates here from the thoracolumbar fascia. We cannot see that. on this model. The Latissimus dorsi inserts to the floor of the intertubercular groove of the humerus. That's here, this is the humerus, and here should be the floor of the intertubercular groove of the humerus. The innervation of the Latissimus dorsi is accomplished by the thoracodorsal nerve, and that's C6 here till C7. The function of this muscle is that it pulls the forelimbs, this here, it pulls it backwards and caudally, it pulls it downwards. And now I will talk about the rhomboid muscles. Here is the right rhomboid major, and here is the right rhomboid minor. So we have two rhomboids. One is inferior, one is superior, and the one that's superior, it's minor, and this one is major rhomboid. Basically, their origin is the nuchal ligament here, and the spinosus process from here, from the 7th cervical vertebra, and all the way down till the 5th thoracic vertebra. It inserts on the medial side of the scapula. It is innervated by the dorsal scapular nerve from C4 and C5. What they do is actually they retract the scapula, and they also rotate the glenoid cavity. But if you remember when I talk about the trapezius muscle, I said that they rotate the glenoid cavity upwards. What these muscles do is that they actually rotate the glenoid cavity downwards. So you can see here, when they pull this side of scapula upwards, this side of scapula has to go down. So the glenoid cavity rotates downwards. And the last muscle I will discuss in this video is the levator scapulae. They originate from the posterior tubercles of the transverse process of the vertebrae from C1 to C4. It inserts on the superior part here of the medial side or the border of the scapula. The innervation is basically the cervical nerve number 3 and 4 and the dorsal scapular nerve, that's C5. Pulls the scapula up. When it pulls the scapula up, it also brings the glenoid cavity a little bit down. Now let's repeat all the muscles that we learned in this video. We have learned the trapezius muscle here. If we remove the trapezius muscle, we can clearly see the latissimus dorsi here. We can remove it. This muscle here was the levator scapulae. We removed that muscle, and these muscles here were the rhomboid muscles, and actually this was the minor rhomboid muscle, the superior one, and this one that's left was the major rhomboid muscle.